Good evening, I'm Dana Tyler. We begin with the closure of a New Jersey pain management center. CBS 2 has learned more than 30 patients who received knee injections wound up with infections, and some people even needed surgery. CBS 2's Meg Baker has the story tonight, new at 6.
Mary Adams says she had been experiencing knee pain from years of working on her feet as a chef in New York City. So she went to the Osteo Relief Institute in Wall Township.
Because I was getting like pains in my knee, and they said they could get rid of the pain without any surgery or anything. It happened, so I end up here.
Bedridden in a rehab center, Adams developed a serious infection of sepsis from a knee pain injection. Adams says it was her second injection here at the Osteo Relief Institute, and within hours, she knew something was wrong. So she went back to the private practice off Route 34 South, but says she was given little help.
I went back to them, and then after they didn't really pay no kind of attention to me, I told my daughter to take me to the emergency, and that's where I went, and they admitted me and told me I had to do an emergency surgery.
Adams is not alone. The New Jersey Department of Health is investigating 31 cases of knee injection infections so far. In a statement, the agency says infection control issues were found during an inspection by state and local investigators on March 13th. Emergency room physician Alan Now from Centra State Medical Center explains the seriousness of these cases.
It could actually be pretty catastrophic. An undiagnosed septic joint could lead to destruction of the joint, sepsis throughout the entire body. It's one of those things that really needs to be diagnosed pretty early on. He
says the bacteria can manifest into pain, fever, and chills.
We put our trust in everybody, right? So, I don't know.
Osteo Relief stopped administering the injections on March 8th. Today, there was no answer at the door, no response to our calls. So far, Adams has spent 8 days in the hospital and 9 days in rehab. She says she prays to be able to get back on her feet and cook a homemade meal. In Wall Township, New Jersey, Meg Baker, CBS 2 News.
And Meg adds that many of the patients infected have already retained lawyers.